Hi guys, good to see you guys again. My name is Dr. J and today we'll be studying about blood clotting mechanism, right? Now, have you ever noticed when someone gets hurt, they start bleeding, am I right? Now, when they bleed, right, your body carries out a process called blood clotting mechanism. It's to prevent excessive bleeding. It's to ensure that no bacterial infection gets into your body, right? It also maintains your blood pressure. Now, these are the reasons why do you need blood clotting mechanism, right? So, let's see how it happens, okay? Now, first of all, right, now, over here we have a clean, unbroken vessel, right? It's a normal blood vessel. And then, when you suffer from an injury, you have a broken vessel. And what happens during that time? Your blood starts coming out. You start bleeding. And together with your blood, right, you have your red blood cells, white blood cells, and platelets flowing out, right? Now, this activates a mechanism, right? And that will actually cause for you to have the blood clotting mechanism to take place. Now, when this mechanism takes place, eventually it will stop the bleeding and cause your body to heal, right? So, let me explain further, but before that, let me give you more room. I'm going to disappear right now. Now, when you take a look at this, right, whenever you have a trauma, right, the trauma will activate platelet plug. That is a bunch of platelets sticking together, right? Now, the platelet plug secretes an enzyme called thrombokinase or thromboplastin. Now, these enzymes will convert the protein prothrombin to become thrombin. Now, for this to happen, you must have calcium ion and vitamin K. Remember that. Now, thrombin converts fibrinogen to become fibrin, and fibrin forms a scab over your wound to prevent injury, to prevent excessive bleeding, and to allow your tissue to heal beneath your skin. Alright? So, when the tissue heals, eventually the scab will fall off. Alright, now, these are very important terms that you must understand that always comes out in SPM. Now, here, you can see that, alright, thrombus, thrombosis, and embolus. Do you look? They sound almost alike, right? So, how do you differentiate them? Alright, so first of all, a thrombus. A thrombus is a blood clot in an unbroken blood vessel, right? Remember that. Thrombosis is when this blood clot obstructs the blood flow to a specific tissue, causing ischemia, like what is happening in stage 3. Alright? And then embolus is when that blood clot breaks off and travels to another location and does the same damage. That is called as an embolus, right? You can see this happening in stage 4, okay? So, these are all the 3 things that you must remember, right? Right, now, here we have another disease that is very important for SPM. They love to ask you this, especially in KBAT, right? Now, here, an individual is suffering from a disease. He has spontaneous bruising. He has excessive bleeding, all right? He has severe headaches and he urinates blood. All these are the effects of someone suffering from hemophilia, all right? Now, what is hemophilia? Do you remember just now I told you prothrombin, thrombin, fibrinogen, fibrin, vitamin K. All these are clotting factors. Now, hemophilia is a disease where someone is born without clotting factors, all right? So, this, remember the disease, is called hemophilia, right? We also call it as the royal disease, as the British royal family, right? Their bloodline has this disease, right? So, that's why we call it as the royal disease, right? Now, let's take a look at some questions, right? Now, here is a 2016 question, all right? It is asking you that when a boy accidentally cuts his finger, the blood starts to clot slowly, all right? So, why do you think, all right, his blood is clotting slowly, right? And the answer is, of course, because his body has lack of vitamin K, right? Why is that? Vitamin K helps the conversion of prothrombin to become thrombin, right? Remember that. Now, here's another question. Now, this is from 2015, right? Now, this is showing you, right, a platelet plug, right? A platelet plug taking place, right? And the question is so simple. They're asking you, what is the cell responsible for X? So, of course, the answer is platelets, all right? Okay then, so we're going to stop here and we're going to see another topic very soon, right? So, till then, bye-bye.